Yes. Because of that dynamic capability, monitoring somebody after a stent is very useful with MCG, because if you start seeing a progressive rise in the score, it indicates that the stent is in trouble, particularly over the first 3 to 6 months. So we use it as a tool to monitor after revascularization to detect restenosis. No,
Every 6 months or so?
Typically, we do a repeat nuclear stress test at approximately the 6-month mark after a stent is implanted. And only will we reinvestigate using angiography if the nuclear stress test is abnormal. But many times after a stent, the nuclear stress test does not return to normal. And so you can get a misleading result with nuclear stress testing that was abnormal before the stent is implanted and continues to be abnormal after the stent is implanted. So using the MCG is, I think, a more accurate way of determining whether restenosis is occurring, particularly if you see the score dropping immediately after the stent is implanted.
I see. So it's less expensive and more accurate.
More accurate. Procedure. That's a very good way of saying it.
I see.
Well, as I mentioned, I've been using the device for the last 2.5 years. In the United States, that's about the duration of history of use of the device. We have information, and I'm following a number of people over a 2.5-year period. And I find, again, continue to find the device to be very useful. If the scores have remained stable, then the patients in general have remained stable. I have not seen any dramatic deviations in terms of events that don't correlate with an abnormal score. So I think the accuracy in a given patient over a long period of time is there. I think it's I have had no reason to think that the device is not accurate over a long period of time in a single patient. Yeah, I think we need trials in a couple of different areas. I think we need more paired comparison trials where the device is compared to an existing technology like nuclear stress testing or CT angiography, and see whether or not one device is as accurate or more accurate than the other device in predicting who has a blockage and who hasn't. That trial is in the process of being done. I'm conducting a component of it here in my own practice. Right now we have over 150 patients in the trial that have undergone both MCG and nuclear testing prior to their catheterization. And so we're putting that data together, hopefully should be published very soon. The other area where I think we need more trial-based information is in the evaluation of patients presenting to an emergency room. People that come to an emergency room complaining of chest symptoms very commonly occupy a lot of space and resources in a hospital, because the hospital has difficulty identifying who really has the problem and who doesn't. If this device is used in an emergency room, it could very much help the treating doctor identify this patient needs more work, this patient can go home without a lot of expensive testing to determine who can leave and who can't leave. So we see a potential role for that, and right now we're preparing to conduct a multi-center trial of the use of the device in an emergency room setting.
That's very interesting. And so the hospital can accept more emergency patients.
Yes, and only admit and treat the ones that really need admission and treatment.
Okay, thank you very much. I'm very much convinced about this new technology. So I hope you will do more research and give us more information in the near future.
Thank you very much. It's a pleasure meeting you.
Okay.